Hello everyone. So now we will discuss about septicemia and bacteremia. So what is septicemia? Septicemia is the condition when there is rapidly multiplying highly pathogens bacteria present in the bloodstream, and these bacteria also form microcolonies in one or more tissues. Okay? The pathogens are circulating in the bloodstream, and along with this, these pathogens are forming the microcolonies in one or more tissues of the body. This condition is called septicemia. What is the pathology behind the condition? When the body gets infected with the septic cocci or pathogens or septic bacteria such as streptococcus, staphylococcus, and pneumococcus. Now, these bacteria releases toxins. The toxins may be alpha, beta, or gamma toxins, and these toxins then act upon the multiple organs and tissues, resulting into the systemic generalized toxic effects or toxemia. Now, what will be the clinical features, or with what features the patients will present to the surgeon? The patient may present with fever, malaise, lethargy, generalized weakness, multiple small hemorrhages, neutrophilic leukocytosis, and disseminated intravascular coagulations. Okay, what is neutrophilic leukocytosis? You know, there will be increased number of the white blood cells, and which type of white blood cells will be increased high? Neutrophils are the specific white blood cells which increase in their number when there is acute infection in the body. And disseminated intravascular coagulation, what is this? When there is the infection of the pathogens inside the body, and these pathogens uh, these pathogens destroy the endothelium of the blood vessels or the small blood vessels. When the endothelium of the small blood vessels gets destroyed or damaged, there will be aggregation of the platelets resulting into the coagulations. So disseminated intravascular coagulation results when there is high growth of the pathogens inside the blood vasculatures. What investigations will you carry out to investigate the condition of septicemia? One is direct microscopy. What is this? You collect the sample of the patients and visualize it under the direct microscope of high magnificence. You can visualize the presence of pathogens or bacteria inside the blood. This is direct microscopy. Or another options, we have blood culture and sensitivity. We keep the blood for 72 hours for the culture of bacteria and then find out the sensitivity of the pathogens against to which antibiotic it is sensitive. What will be the treatment? Only the treatment is administration of IV antibiotics and supportive treatments. Now come to the another condition, which is bacteremia. Apart from the septicemia, the bacteremia is very mild condition and it's very benign conditions. uh, there is the condition is when there the pathogens presence in the blood and do not multiply so quickly and do not produce toxins so quickly as in condition of the septicemia. So what is this? This is a condition of presence of small numbers of bacteria in blood which do not multiply. Unlike septicemia, bacteria do not form microcolonies in one or more tissues. What would be the pathology? The pathology is also very mild. Although bacteria are present in blood but neither multiply nor produce toxins, only mild fever may be present. With what features patient may present? It would be a fever, it would be a generalized weakness or leukocytosis. Of course, there will be leukocytosis because there is infections of the bacteria to the body. Investigations, as far as the investigation is concerned, the blood culture and sensitivity is only the options to investigate the condition like bacteremia, because under direct microscopy the pathogens or bacteria cannot be visualized because the number of the pathogens or bacteria are not so much so that they can be visualized under direct microscopy. If you talk about the treatment, the condition may be resolved spontaneously in mild cases, or in some and rarest cases, oral administration of antibiotics may be required. So here you would see the basic difference between the septicemia and bacteremia. First, In septicemia, presence of bacteria with their multiplications. This condition is septicemia, and in bacteremia, there is only presence of bacteria. Number two, septicemia is life-threatening condition, whereas the bacteremia is not a life-threatening but is a benign condition and is not dangerous as septicemia. Number three, septicemia arises from infection throughout the body, including infection in lungs, abdomen, and urinary tract, whereas the bacteremia may occur through a wound, injection, or surgical procedures. Number 4. Toxins are produced in condition of septicemia and toxins are not produced in condition of bacteremia. Number 5. The clinical features in septicemia would be fever, malaise, disseminated intravascular coagulations, multiple hemorrhages. And in case of bacteremia, there would be only mild fever to the patient. Number 6. If we talk about the treatment, heavy doses of antibiotics are required to treat the conditions like septicemia. And in case of bacteremia, this condition may resolve without treatment, but in some cases, oral antibiotics are required. So, this was all about the septicemia and bacteremia. Thank you so much.